Hey everybody, welcome to the Chamber Channel's 5 Questions podcast. This is the place where we take a deep dive with industry leaders for an inside look at their world and how they can make a difference in yours.
Prioritizing health is really no longer about treating symptoms. It's about taking a whole body approach to well-being. And Dr. Heather Hinshelwood of Fraum Health is a champion of holistic wellness. She's been helping patients find balance through integrative care. We sat down with her to discuss how small changes can lead to big results and why taking a proactive approach to wellness matters more than ever. Let's listen. So you bought this practice from a longtime business owner. What was it like taking over a well-known business and making it your own?
Well, I had the luxury of having worked there for 7 years before Henry and I bought it from Dr. Fraum. So I don't know that just based on my personality, I ever would have bought something I wasn't already involved in, but I was involved in it. And so, Brad had been working for 40 years. He was at that clinic for 30 years with his name on the door. Like, that's a big legacy. Those are some big shoes to fill. But I'd already been there. And, my experience for those first 7 years have been just so wonderful. But, from the beginning, when I started working there, if I told Dr. Fraum I needed something, we got it. There was no questions asked. Like, hey, we need this for patient care. Okay. I did have that pre-existing experience, but even with that, taking over somebody else's business is hard work. And I wasn't even the one doing most of the hard work. It was really Henry who, what that man has accomplished in the last 2 years is I could not have done this without him. So
I think it's an interesting approach that you take when it comes to, you definitely have more of a functional medicine, functional health focusing on the whole person rather than just the symptoms. Tell us a little bit about the key pillars of that philosophy and how you're working that, and maybe some things that people should probably pay a little more attention to.
Yeah, absolutely. So for starters, at the clinic, we want to empower patients to live pain-free, vibrant lives. Okay. And all those things mean a lot to the patient themselves. Feeling like you're in control of your own health care and control of decisions that greatly impact your life is very important. Pain-free is another big one. I say pain-free. I don't think it's realistic to think that none of us should go through a day with no pain whatsoever. But I don't think it's acceptable to have to suffer through basic daily tasks and suffering through doing the things we love, like golfing or tennis or something like that. The other part of that is that medicine, the general approach for medicine right now is if you show up to your doctor and say, hey, doc, my knees really hurt when I play pickleball. My back really hurts when I golf. Well, what do you expect? That's the answer you get. It's, well, you're 80. I mean, what do you want me to do about that? And that is super unacceptable on so many levels to me. Number one, I think it's, kind of disrespectful for what the person has been through their life. Our patient population, most of them, they have worked very hard during their lifetime. And this is the phase of life where they're retired and wanting to just enjoy themselves, right? But at the same time, it's also the phase of life where, parts of our body start to give out. And, maybe this is me reflecting my own desires into the situation, but I want one day to be that person who gets to, spend the day doing the activities that I love, without my body falling apart at the same time.
Do you feel like people are looking at things these days with a little more of a health span versus lifespan angle?
I think we're slowly getting there. I'm hearing that conversation more and more. I'm a little concerned that maybe I think people are having that conversation more and more just because I'm in this space more. But I really do think we need to be more aware of that it's about quality of life, not just quantity of life. Dr. Fraum had a saying, we should be like candles, flicker once or twice and go out, right? My background is in emergency medicine. And what I tell my patients is, you come see me in the hospital in the ER and give me 30 minutes and I will spend $1 million on you. No problem. No problem. Without blinking, $1 million down the drain. The problem is you are not going to have $1 million worth of health after that. You're just not going to. And I think people are understanding that more and more and not wanting to live, stuck in a bed somewhere. I think they want to be playing golf until, the day they leave this world, which I want that for them too, because it's all, the ability to do those things is also going to keep their quality of life better and keep them healthier in the long run. So if we can empower patients to do the things they love and remove the physical barriers that might be there to keep them from those activities, then by default, we're going to improve health and quality of life and possibly longevity, but certainly reduce morbidity related to chronic medical conditions long term.
Now, if you could wave your medical magic wand, as basic as they may be or as out there as they may be, what are the top 3 things that you would recommend to your patients to do exactly what you're talking about, to live that long, healthful life, doing the activities they love to do? What are your top 3?
Number 1, weightlifting is non-negotiable, period, end of story. It is not optional. Unfortunately, it was really starting with my generation of women where we did go to the gym and start weightlifting. And even my generation, I was kind of unusual in that, now the 30-year-olds, 20-year-olds women are in the gym. The women above my age group were not in the gym and by and large are are not super strong physically because of it. But the trouble is that we know that things like grip strength directly correlates with your ability to live independently across your lifetime. It just does. So number 1 is weightlifting is not optional. And I don't care how old you are, you need to start. And, I've got suggestions for how to do that safely, who to go see, but that's not an option if you want to live the quality of life you're hoping for. That's number 1. Number 2, metabolic health. Okay. We can start naming all these chronic medical conditions, Alzheimer's, hypertension, high cholesterol, diabetes, all these cancers, and not like one type of cancer, right? Like we could point to lung cancer and say smoking, but these days we're seeing this massive uptick in cancers of all type, which is really concerning because there's no super clear discernible root cause like there was with lung cancer, right? But the root of all of these things is metabolic health. If our cells are healthy, they won't let themselves get out of regulation and become a cancer. Okay. If our cells were healthy, they wouldn't have any issues metabolizing glucose. If our cells were healthy, we wouldn't be depositing trans fats all over our bodies. We would just take care of it. So metabolic health is really the fundamental thing underpinning all of these chronic medical conditions that our society is struggling with quite a bit. The last one is that our personal health is really our responsibility. And the biggest gains we are going to make in our personal health have nothing to do with how many doctors you go see. And in fact, I'd argue that if you spend a lot of time going to a bunch of different doctors, that's a harbinger of a pretty rapid decline in health overall. We need to be doing things like going outside, eating well, exercising, intermittent fasting, keeping our minds engaged, things like that. And those personal choices that we make on a daily basis have a far bigger impact on a patient's health and well-being than I ever do as a physician.
Interesting. You mentioned the weightlifting or that weight-bearing exercises not being an option. There have been a lot of recent studies to that effect that talk about how more than smoking, more than anything, if you're not have that balance and that ability and agility, it leads to that whole host of people don't really understand the domino effect.
No, they don't. And but if you ask them, do you want to end up in a nursing home with a broken hip? Well, absolutely not. Right. The answer to that is the gym. Well, I don't lift weights. Well, I didn't ask if you do right now. I said you need to. So
right, that starts that you've heard of that continuum. You break a hip, and then boom, boom, boom. Here we go.
60 to 80% mortality within 6 months after that, and that starts with fall and balance right there.
Stress is a major factor in overall health, isn't it? What are some of the effective ways that you feel like we can deal with that? I think that's the silent one in the background that people aren't taking into account? What are your thoughts on that?
I think, we can't control external factors, right? But we can control how we respond to that. And I don't think we as a society have done a great job teaching ourselves how to respond, not react, and how to set healthy boundaries, right? And those healthy boundaries are emotional, they're professional, they're familial, saying, hey, everything from your boss saying, calling you at 9 p.m. about a work matter. Hey, sir, I'm sorry, this is after working hours. I'm happy to discuss this with you tomorrow. Well, what do you think I'm paying you for? Well, you're paying me to be there. Those sorts of respectful boundaries that get you peace in your house, that nobody else is going to do those for you, right? And so I really think if we could learn healthier boundaries and responding, not reacting to external factors, because then it doesn't matter how severe the external factor is to some extent, we'll have a much easier time dealing with it.
And just because you're retired doesn't mean you're not dealing with that stress.
Oh, big time. Retirement is a huge life change, right? And it's also a time of life where, some other things could be going wrong in your family that have some pretty significant consequences. Maybe adult children who are struggling, maybe to the point that, grandparents have to take over raising the grandchildren, just because you're not working 40 hours a week or 80 hours a week or however much it is. It doesn't mean that there aren't stressors. And I would argue that's a phase of life with some very major stressors.
Yeah. So many people wait until they're in pain. Mm-hmm. They're facing health challenge before they seek care. Yep. How can a proactive approach to your own wellness improve long-term health?
Absolutely. Well, for starters, you don't have to invest as much time, energy, and money into that, right? So if you're walking every day and weightlifting, that the money you put into that is going to be pennies on the dollar compared to what you'll have to pay for co-pays from falling and breaking a hip or having a head bleed or something like that, right? And I love helping people come back from that stuff, but the initial investment is far cheaper, and the quality of life that you get from that investment, I can't even state enough what a big return that is.
How do you help your patients deal with the onslaught of information we're all dealing with? Take this supplement, yep. Don't take this supplement, do this, don't do that. What are some resources that you recommend to your patients to find out credible health information that they can work from?
Absolutely. Well, for starters, because I do get this question quite a bit, I actually have a number of pro athletes who come see me a couple times a year to help get their supplement taking under control. But the bottom line is, I say, for starters, what is your goal here? What are your health goals? Because especially with, let's say, supplements in particular, that is an unending rabbit hole that you will never come back from if you just throw yourself into it. So I ask people to start health goals. We take a look at their life, their temperament, and what makes sense for them, something that they could continue long term, right? Those are two big ones. And if it doesn't matter what you tell a patient, it doesn't matter how good the advice is, if it's not going to jive with their life, they're not going to do it. And so that really has to be taken into account. But the other part of that is also to make sure that the sources are credible, for starters. Just to kind of give you an example, the GLP-1 medications have been a topic of a great deal of debate. Okay. Actually, yesterday, Novant was kind enough to have me speak to Latitudes, to a group of seniors there, about some true information from a medical standpoint about the GLP-1s and their benefits and that sort of a thing. And that's a great example of something that there's a lot of misinformation out there being pushed on us from unqualified individuals who really have no business speaking up about it, right? So I would also say, please check your sourcing for this information. And I mean, the peanut gallery has lots to say. That doesn't mean it's accurate.
And
So-
Dr. Google, you have to be,
Oh my God. Oh, Jesus.
you have to be careful about,
Yeah.
again, it's where are you clicking?
Oh,
You can
big
go to
time.
a number of
Yeah.
different places, like you said, but Huberman or there's just some great resources out there that can help you kind of separate. Let's talk a little bit about semaglutide.
Yeah.
That is such a trend, hot time. I mean, it's sort of really changing medicine in so many ways. What are your thoughts on that for our listeners?
I love it. It's a miracle drug, honestly. We talk about these individual aspects to it, weight loss, type 2 diabetes, but really what it's cleaning up is metabolic health, as we talked about earlier. It is restoring cellular function in ways that I don't think we understand just yet. For example, the benefits we're seeing in diabetes far exceeds, blood sugar control. We can't all chalk it up to just straight sugar control, the benefits we see. The research being done on it in dementia. So it's looking more and more like dementia is a metabolic issue.
Other countries, they call it diabetes type 3.
Yep.
They don't call it dementia, Alzheimer's. They call it type 3 diabetes.
Yep. And I'll use that in my patients who have been diagnosed with some cognitive decline. I'll put them on a low dose of that and NAD, and I'll watch them have better short-term memories than their spouses. It's kind of cool.
Anything else you'd like to tell us that's hot on your list with your organization that you would like to communicate to our community as a whole? Because community health matters.
Yeah, it does. I would say, be proactive, take your health into your own hands. I'd really encourage people to not settle only for what your insurance will pay for. You are not going to like where you're going to get. You're just not. Okay. So, doing things that right now are pay out of pocket will get you those big long-term benefits. Again, what you put in out of pocket will be far cheaper than what you pay in copays for serious medical issues that are coming down the pipeline.
Yeah. Especially if there are tests. I know some people do enhanced blood tests, or there are new tests out now, like the Gallery test for cancer. There are just a lot of things, and having a medical professional guide you through those.
Yeah. And I would also say, we've got to keep our joints healthy. That's another big one, because if our knees are eaten up with arthritis, we're not going to get super far with the weightlifting or the walking or any of these other things. And, pursuing alternatives alternative therapies, before, don't wait for somebody to tell you you need a knee replacement or something before you go do something about your joint health. Don't just ride entropy to the end. We gotta do better by our bodies. So.
Great information. Yeah. This will not be our last podcast together.
Excellent.
Thanks for joining us.
Thanks everyone for listening. The podcast continues to grow, and never miss an episode of our 5 Questions podcast by subscribing to the Chamber channel on Apple, Spotify, or wherever you get your podcasts. Take a moment to download, subscribe, and leave us a review. It helps us reach more people.